Supplements that halt curve progression. Controlling the progression of curvature in children and adolescent idiopathic scoliosis following the administration of melatonin, calcium, and vitamin D by Herdia and colleagues, 2022. This study explored whether taking supplements, specifically melatonin, calcium, and vitamin D, could help slow or stop the spinal curvature in children and teens with idiopathic scoliosis, AIS. Idiopathic scoliosis is a condition where the spine curves abnormally sideways, and doctors don't know exactly why it happens. It affects about 2 to 4% of kids and is most common during adolescence, especially in girls. Even though most cases are mild, some progress to more serious curves, which can affect appearance, cause back pain, or lead to breathing issues. Traditional treatments include watching the curve, physical therapy, bracing, or surgery, but all focus on treating the effects, not the cause. The researchers wanted to test a new, less invasive idea, adding supplements that may help bone health, balance body chemistry, and even protect bones and nerves. This could offer a simpler, more widely accessible way to help manage scoliosis. How the study was done. From 2017 to 2020, doctors in Bucharest, Romania conducted a randomized, case-control, interventional study with 51 participants between the ages of 7 and 16 who had been newly diagnosed with idiopathic scoliosis, Cobb angle over 10 degrees, and Risser score between 0 to 3, meaning they were still growing. The children were randomly divided into two groups. Study group, odd numbers, took daily supplements of melatonin, 1.5 milligrams, calcium, 600 milligrams, and vitamin D, 2,000 IU units. Control group, even numbers, did not receive these supplements. Both groups had blood tests at the start to measure vitamin D, calcium, and melatonin levels. The study group repeated blood tests at 6 months and 1 year, while the control group did not. The spine's curvature was measured using the Cobb angle at the beginning and after the study period. Patients were tracked for at least 1 year. What the study found. The initial test showed that many kids with AIS had low levels of vitamin D and especially low calcitonin, a hormone that helps regulate calcium. Some kids also had low melatonin. The important findings. Lower vitamin D levels were linked with a greater chance of scoliosis getting worse. The kids who took the supplements, melatonin, calcium, vitamin D, saw less progression in their spine curve compared to those who didn't take them. The researchers called these results preliminary, meaning the early findings are promising, but more studies are needed to prove the effects. So the study suggests that correcting deficiencies in these nutrients could slow the curve progression in some kids with idiopathic scoliosis. What this means. Imagine your body is missing some important helpers, like vitamin D, calcium, and melatonin. This might affect how your bones grow or how your spine stays straight. This study found that many kids with scoliosis had low levels of these nutrients, and giving them extra helped slow down the curve from getting worse. It's not a cure, and it's early research, but it suggests that for some children, a simple daily vitamin could help their condition. Why this is important. New treatment idea. Instead of only focusing on bracing or surgery, this study looks at treating a possible root cause, missing nutrients. Supplements are simple, affordable, and safe when used correctly. Better quality of life. If curves progress more slowly, kids might avoid more intense treatment later. That could mean less stress, fewer clinic visits, and potentially avoiding surgery. Worldwide access. Vitamin D, calcium, and melatonin are available almost everywhere, even in places with limited medical resources. Growing bones in growth spurts. Since AIS often worsens during growth, supporting bone health early could matter a lot for outcomes. Things to keep in mind. Small group, 51 patients. The study isn't big, so the findings need testing in a larger group to be sure they hold up. Not all scoliosis is the same. The study only included recently diagnosed kids. Results might not apply to everyone. We don't know cause and effect. The study shows an association. Kids taking supplements had less curve progression, but it doesn't prove the supplements always cause the improvement. Missing details on exact results. The study doesn't report numbers like exact change in Cobb angle or how much better the test group did compared to the control group. A closer look at the supplements. Melatonin is known for helping with sleep. Melatonin also helps bone building by encouraging growth and reducing bone breakdown. Low melatonin has been tied to scoliosis in animal studies and some human findings. Vitamin D is essential for strong bones and muscle support. Vitamin D helps the body absorb calcium. Many children with AIS have low vitamin D, and it's been linked to worse curves. Calcium is a core building block for bones. Without enough calcium, bones don't grow properly. Paired with vitamin D, it helps bones stay strong during growth spurts. Summary: what you need to know. The study tested whether taking melatonin, calcium, and vitamin D could slow spine curvature in kids with idiopathic scoliosis. 51 kids, ages 7 through 16, were randomly split into two groups. One took supplements, the other didn't. Kids with low vitamin D tended to get worse curves. Kids who took supplements showed less curve progression, suggesting the supplements helped. The results are promising, but more research is needed to be sure. Supplements are simple and accessible, but still should be used under doctor care.